So, welcome again to this first brown bag of this term. We're very lucky to have Jocelyn Kelly agreeing to present the first brown bag. She is the Director of Gender Rights and Resilience, Harvard Humanitarian Initiative, and also an assistant professor at Harvard Medical College, Harvard Medical School. But the best introduction I can provide to her is that she was part of GHP, and some of you might remember her stay there. And so she is delighted to come and present to us, and we are so delighted to welcome her. So without any further ado, I will invite Jocelyn to make the presentation. If you have any questions or clarifications during the presentation, either hold on to them or put it in the chat, and hopefully we'll have about 15 to 20 minutes in the end for Jocelyn to respond to these, and also for you to make any further comments. And we hope to finish by 13:55 for you to go back to your classes or whatever else you're doing. So Jocelyn, over to you.
Hi, everyone. As Dr. Saxena said, this is such an honor. I was absolutely a student at GHP a very, very long time ago, and it is so much fun to be presenting at this first Brown Bag Lunch of the year. I didn't even realize, but the Brown Bag series was one of my favorite parts of going to the Harvard School of Public Health, and so it has this extra kind of fun aspect for me to be talking to you today. So my name is Jocelyn Kelly. I direct the program on gender rights and resilience at the Harvard Humanitarian Initiative. And I'm going to be telling you today about a project that I'm working on really actively right now. And for the reason, keeping in mind that this is really in-process work, that is something that I'm kind of refining and working with our project partners on currently, I am particularly pleased to be presenting to this group and particularly excited to get your reactions, feedback, questions, input. I really enjoy more of a dialogue format compared to a straight kind of unidirectional lecture. So please feel free to come off mute and jump in with a question or comment or reaction. I know that can be a little difficult and a little scary, so no worries if you decide not to, but otherwise we'll definitely have time for Q&A at the end, which is always the best part of any presentation. So as we start to jump into my talk today, I wanted to note that I'm just the mouthpiece for a pretty extraordinary project team. We've worked together now for, I would say, almost 10 years. And the project team is a consortium. It's led by an extraordinary woman named Annie Mwange and represents a group of 3 Congolese women-led NGOs, ASEFA, IFED, and SOFEDI, as well as a Congolese research firm, RISD, and the Program on Gender Rights and Resilience at the Harvard Humanitarian Initiative, which I lead. And the project that we came up with to work on together was very kindly and bravely funded by USAID, which is, I think, doing more work to really make sure that they can get funds to grassroots organizations who are kind of the experts in the issues that they see on the ground. And actually happy to talk about this funding mechanism a little bit more. I know it might sound a little boring, but actually USAID has initiated something that they call the RISE award that they do every single year, which stands for Resilient, Inclusive, Sustainable Environments. And the goal of the RISE award is to reach out towards on-the-ground actors all over the world who are at the forefront of kind of fighting climate change and supporting women's rights. And we were really lucky to be in the inaugural cohort of the RISE program. And those are the results that I'll be presenting today. So let's zoom all the way out and think about framing this lecture, in the broadest terms. I wanted to start with the fact that gender inequality and climate change are 2 of the greatest development challenges facing the world today. 1 in 3 women has been a victim of gendered violence in her life, making it the most common human rights abuse in the world. And you only have to read the news to acknowledge that climate change is probably the most pressing issue that we're facing today, and is something that we are going to be grappling with increasingly in the years to come. One of the most promising ways to address climate change is through a shift to quote unquote greener economies. That is, economic systems that reduce environmental risks while supporting sustainable development. Tin, tungsten, and tantalum, also known as the 3T minerals, are vital resources to allow a pivot away from fossil fuels and towards clean technologies, such as solar power and electric cars. Already in high demand, the World Bank estimates the market for these 3T minerals will grow 500% in the next 3 decades. But the shift to more sustainable energy can come at a great human cost. And this cost is particularly high for women. 70% of these 3T minerals are mined in Eastern Democratic Republic of the Congo. It's a country deeply affected by political instability for decades. And that instability is characterized by widespread human rights abuses and particularly horrific forms of violence against women and high levels of gender equality. Yet women comprise half of the mining workforce. Despite this, they're systematically denied equal treatment while facing alarming levels of exploitation and abuse. A study we conducted before we started this project in the mineral-rich region of Eastern DRC found that 1 in 7 women were forced to trade sex just to access work in mining towns. And 1 in 3 women had been sexually harassed in or around the mines. Women chose to work in this sector because it does provide unique economic opportunities in a place where jobs are few and far between. But it also carries the risk of deep discrimination, exploitation, and abuse. So a pressing question is, how do we ensure that local communities, and particularly women, can be further elevated and recognized as climate leaders in the green transition, while also reducing these incredibly intense forms of violence and abuse that they face as part of working in these mines? So another way to frame it is to think about a problem statement. The problem that we're grappling with is the most important minerals for the globe's green energy transition are being mined in ways that harm and marginalize women. And it's not clear how to balance climate needs and equity considerations. So the question is, do we have to trade one pressing global priority, climate action, for another, which is the quest for gender equality? I and the project team wanted to reframe this kind of seeming contradiction. We came together to design a new kind of curriculum, one that actually links together the goals of advancing climate justice and gender equality in the communities that are so critical for this green energy transition. I want to note that I and the project partners have worked together for over 10 years now, and through that process of collaboration, doing research projects together, identifying all of these issues, we really felt like there was a space and a pressing need for a new kind of intervention. We wanted to create a women-led, evidence-based intervention that we ended up calling resourceful empowerment. Yes, it is shamelessly a little bit punny because it's about resources, but it's also about being resourceful. And we're just going to lean into that name. It takes a human-centered approach. We wanted to create a training that was cost-effective, sustainable, and replicable. It kind of takes a training of the trainers model where women can understand how to give the intervention, give it to many communities in the province where they live, but also train up other women as trainers as well. It uses visual materials to facilitate comprehension. So we know that a vast majority of women, but also men working in mining towns, have been robbed of the opportunity to get an education. And so by using visual materials that clearly communicate some of the points that we're trying to make, we're hoping to create something that's accessible, immediately understandable, and feels like it's reaching out to grab communities in a way that really makes sense to them, as opposed to kind of being exclusionary or difficult to understand. We wanted to make inclusive methods that ensured that women in marginalized groups were included in the design. And that's one of the reasons that we did draw on these visual methods, because people really noted that that was something that made them feel like a part of the training. So on this slide, you can see an example of one of the images that was created for this project. I want to note that all of the images you see here are done by an extraordinary woman, Congolese comic book artist, and we felt really, really lucky to be able to work with her. Another image that was created for the intervention, I wanted to share with you all because in some ways this image encapsulates so many of the problems that we were trying to address. So on the lower left-hand side of the screen, you see two women kind of trying to listen in to a round circle meeting of men gathered around a fire. And this image conveys an example of a community leadership group. And one of the challenges that we noted in mining towns is community leadership groups were always comprised of male leaders and male community members. And what you see is women trying to listen in, trying to understand the decisions that are being made about them, but without them, and understanding how these decisions affected their lives, even though they didn't have a voice in that process. In the upper right-hand corner is depicted another incredibly pernicious and dangerous problem that women in mining towns face. There's a woman here who's talking to a male leader, and he's got his hand up and he's shaking his finger, and he basically is telling her, you're not allowed to work here. So there's a really intense misunderstanding that women are actually not allowed to work in mining towns, even though they do comprise 50% of the workforce. This is a misinterpretation of the Congolese law, which states that pregnant women are not allowed to do physically harmful or backbreaking labor when they are showing their pregnancy. And this is, clearly a law that was put in place as occupational health and safety to make sure that pregnant women aren't exposed to harmful chemicals or aren't hurting their fetus by doing backbreaking labor. Absolutely a very, very well-intentioned and important law. However, over the course of years, women are being told either on purpose or perhaps in some cases it's a honest mistake. This law is being interpreted as saying that no women are allowed in mining towns. And this is being used as, frankly, a kind of a form of blackmail. So women are then forced to trade money, food, sexual favors to be, quote unquote, allowed the privilege of working in mining towns. And this is one of those kind of core, foundational, brutal lies that is allowing these high levels of violence to occur. So here in this kind of relatively simple image, you are seeing a lot of these complex dynamics portrayed. And this image is an example of a vignette that we put up as part of the training to spark dialogue, to spark problem solving, to spark critical dialogues around some of the social dynamics that occur in these mining towns. Okay, so as I said before, we created an intervention that in many ways was completely new. Having said that, we absolutely wanted to draw on best practices and some evidence-based interventions that already existed. So I want to note that we drew on some extraordinary work already done to prevent violence against women within partnerships, so to prevent intimate partner violence. And those interventions were called Living Peace and SASA. They were wonderful and they work on social norms change and violence reduction, but within a completely different context. So we tried to draw on some of the resources there, but then redesign it for this really specific environment. And acknowledging that we were doing something totally new and we weren't exactly sure how it was going to go, we actually wanted to split out our training into two different groups, randomly assign communities to one of these two groups, and then see which one was most effective. So in group one, we had what we're calling a standard training. It addresses awareness around Congolese law and mining code. It addresses human rights, women's protection, and it explores gender norms. And then on the environmental side, it addresses climate change mitigation and environmental protection. Okay, so that's group one, the standard training. In group two, we added, we gave all of these quote unquote standard modules, but then we added additional topics. The first was emphasizing the link between environmental protection and human rights outcomes. So what we wanted to do was help people understand, firstly, that they're connected to each other. People within the communities are deeply interconnected. Violence against a single person is kind of violence against the group, and it reduces your resilience and it reduces your ability to be effective as a social coherent unit. We also wanted to emphasize the link between people and their environment, to note that where you live and how you treat the place that you live comes back on you in really profound ways. And to really emphasize or kind of dig into this interconnectedness piece, we also did empathy exercises. And these empathy exercises involved role play, active listening, problem solving, and really drawing out the threads of how those links work within the community and between the community and their environment. Okay, so those are the two kind of randomly assigned groups that we had as part of this intervention. What did implementation look like? We recruited men and women in mining towns across 3 provinces in Eastern DRC to participate throughout a year-long intervention. So we had 720 total participants. There were quarterly trainings with those images and materials that I showed you before. And these quarterly trainings were actually coupled with self-organized action groups. So for instance, in a training, you might have a group of 20 people. And within those 20 people of men and women, we asked people to self-organize into smaller groups of, maybe 3, 4, 5. And those were the action groups. And the action groups were asked to undertake a project of their own choosing and regularly report back to the group. It was basically a year-long effort where they identified one problem in their community, one thing that they felt that they could change throughout the course of the year, and that they would work on between the quarterly trainings to do together. So that was kind of the design. And we did a pre and a post survey to look at, what changes we saw over the course of the year, and particularly to track whether there were any differences between group 1 and group 2. And we also did really intensive monitoring and evaluation after each engagement with the community to see their reactions to every piece of material and what their proposed improvements could be. Okay, so what did we find? Across all the sites, so both group 1 and group 2, we saw a lot of positive changes. 150% increase in the knowledge of good practices for land recovery post-mining. So ways to not leave this kind of slash and burn raw earth after mining was completed in one area, but to think about how to help that land recover, be reforested, which helps, definitely helps reduce climate impacts when you reforest places. That really helps bring back kind of soil recovery. People decided to plant fruit trees, which were really wonderful because it also, not only did it stop things like mudslides, but also by virtue of planting fruit trees, it actually provided nutrition for the local school kids. So we saw some really beautiful synergies in land recovery. Women who were told that they didn't deserve the right to work in mining towns fell from 26% to 10%. There was increased agreement that both men and women deserve equal pay. That increased from 49% at the start of the project to 64% at the end. And kind of measures of people's own attitudes towards gender equity increased. So it kind of closed the gap between men and women. So we saw that women started with, frankly, more gender equitable attitudes at the start of the project. Women's gender equitable attitudes did increase, but what we saw is that men's attitudes increased even more positively, and they kind of caught up to women. What about those community action groups that I was telling you about? I think this was one of my favorite parts of the project. We saw some really extraordinary things happen. Men and women began to help each other to launder ore at the mining sites. This is a really difficult, backbreaking, and time-consuming task that was traditionally only done by women. Male champions encouraged the creation of women's economic cooperatives. So in the past, only men could be part of economic cooperatives, and that's really where a lot of positive savings and loans, access to financing occurred. And so having women be part of those groups was pretty powerful and extraordinary. Men supported the emergence of female leadership. So men actually nominated women to be part of those community leadership groups that you saw at the beginning that used to only be comprised of men. And finally, this was pretty incredible. We actually saw some instances of strikes where community members undertook advocacy and went on strike to ask for equal pay for equal work, which frankly, we still haven't achieved in the US and many countries around the world. What about that A/B test that I told you about? Something that we didn't expect and that felt really powerful for us was only in the interconnectedness communities, those communities got the interconnectedness version of the training, did violence actually decrease. So in those communities, women self-reported their experiences of sexual harassment in the past month and in the past year drastically decreased. Past month sexual harassment dropped from 32% to 19%. Sexual coercion, such as being forced to trade sex for access to work in mining towns, have from 12% to 6%. And I do want to note that I've worked on violence prevention for a really long time. And it's not always the case that we see reported levels of violence drop within a year based on an intervention. It's a pernicious, sticky, and super complex problem. And it's one of the reasons why in the other intervention group, we actually didn't see any changes in violence. We saw great things happen. People were collaborating to protect their environment. People said that their gender, that their perception of gender equality changed. We can absolutely talk about this in the Q&A. Sometimes it's the case that people just report that their attitudes change because they think that's what you want to hear. Other times, that might be a genuine change that's deeply felt. It's honestly pretty hard to tell from surveys. But one of the indicators that we see does have a concrete change, and particularly for the women experiencing violence, was this kind of drop in different forms of violence that women experience. So what are some of the takeaways from this work? I think we can acknowledge that it's important to support women-led initiatives that draw on evidence-based practice, but also actively engage men in programming. We can think about investing in scalable and replicable interventions that are owned by a community and that community can take forward even in the absence of large amounts of funding. That there's actually a power to linking environmental outcomes with human outcomes. And it's really important to allow communities to self-identify and then pursue shared goals through action committees. Frankly, even though the project consortium that created this intervention is deeply, deeply embedded in the communities that they serve, I don't think we would have come up with the ideas or been able to create the changes that those self-organized community action groups did. It's just something that was organic and really extraordinary to watch take on a life of its own. So if we think back to our problem statement, where we acknowledged that there was a real difficulty when we thought about the most important minerals for the globe's green energy transition being mined in ways that harm and marginalize women. And it wasn't clear how we balance climate needs and equity considerations. I, kind of put forward as a point of discussion that we can think about reframing this problem statement and rethinking this idea that perhaps there's a zero-sum game between climate needs and equity needs. So we can acknowledge that women are leaders and vital actors in mining towns. And when we think about moving into a green energy transition, that they have to be the ones helping us understand how to do this effectively. And that linking the well-being of people and the well-being of the environment isn't only a good idea, it might actually be a force multiplier. It holds promise as a path to achieving equity and climate goals in a way that actually makes both more powerful than if they were addressed in isolation. So with that, I will stop and say thank you for listening. I'm so excited for the discussion and for the questions, and really appreciate you all attending today's talk.
Thank you so much, Jocelyn. Your presentation brought us the work that you're doing very much alive, with all the pictures and all the other drawings that you illustrated so well. So thank you again for that. And the floor is now open for any questions, clarifications, comments, or even sharing the experience that you might have had. Raise your hands and I'll give you the floor. And I see already Aisha is the first speaker. Aisha, please.
Thank you, Jocelyn. That was a great presentation, and I absolutely love the illustrations that were drawn by the local artist. I was wondering if you could share a little bit more about who actually came to the groups and formed the action groups themselves in terms of the gender dynamics and the kind of influence in the community, because I think some of the actions that you highlighted, like advocacy, successful advocacy for equal pay, I mean, are incredible. And it would just be interesting to know more about who participated.
I love that, Aisha. And of course, like that's the core, right? Is who the participants are, the beating heart of the intervention. And without them, it just doesn't work. It doesn't go forward. So the way that we gave this a lot of thought. And as you can probably imagine, or may already know, mining towns are inherently hyper dynamic, very kind of places where there's a lot of coming and going, people pop in, pop out, move to the next mine, it's richer over there, etc. So what we did want to do was find folks who had been in the community for a bit and would be in the community or felt like they could commit to a year of participating in the intervention. And that actually wasn't as hard as we found. So mining tunnels come and go, but some of the mining communities are relatively stable. And we didn't want to necessarily pick out leaders, but we did kind of look for, influencers, right? People that everybody knew and respected and liked and, saw around town and were going to listen to when they talked about what they just learned. So we had kind of a nomination process, and it could absolutely be self-nomination. And based on that criteria, we brought people in who committed to staying for the year-long intervention. So groups were supposed to be about 20. Frankly, they could be much, much bigger, because one of the things that we saw was just wildly enthusiastic amounts of uptake for the opportunity to learn more about what is a really opaque system, which is the Congolese law and the Congolese mining code. So those were the people that we engaged, and it was evenly split between men and women. Something that I think a lot of folks on this call can identify with is that you can really alienate and create resentment in a community if you only work with or provide benefits to one group. So if we're thinking about, improving the lives of women and only singling out women for this intensive training and engagement and, support, that would absolutely create resentment in these communities. We've seen that in the past in DRC in particular. And when you really think about it, the problem of violence against women, the problem of inequitable gender norms, that's not just something that you need to work with women on. That's like something that you absolutely need to work with men on as well. And so having that 50-50 split, having that deep engagement from folks who are then collaborating was, I think, what created so much of the impact that we saw. And to your point about the community action groups, those were among the people participating in the intervention. We had people in the trainings of about 20, 25 people. And then the 20 or 25 people in each community would split out into smaller groups. So 2 or 3 people, 5 people would say, let's work together and let's change this one thing. And absolutely, there's no way that those changes would have occurred without men. I mean, men were the ones driving this change. They were nominating women. And the fact that men nominated women made those nominations much more powerful. The fact that men went on strike for equal pay the fact that men stood up and said, we're going to help you do this really unpleasant job. We're going to stand up and do this with you. Again, none of that would have happened if it was, only women participating in that intervention. Does that help address some of the questions?
Yeah, thank you so much.
Thank you, Aisha, and thank you, Jocelyn. As I wait for other participants to raise their hands, I have a question. I understand that you're trying to change the dynamic of a mining town. Were there any overt or covert resistance from the mine owners or other stakeholders who might have an interest in not changing things, actually?
Yes. And that was, I think, the biggest barrier and concern of doing this work. And I think it's a testament to how deeply trusted and kind of beloved the grassroots NGOs were. So a little bit of background, the NGOs that we worked with, Asafa Ifed, Sofedi, had worked in these mining towns for, 15, 20 years. And frankly, these were women who self-organized to basically pay out of their own pockets. If someone needed to get to the hospital, someone needed a loan for school fees, women were banding together with women to create these organizations to help the community. And I think that sense of goodwill and trust was really important. A big part of what we also did was actually when we applied for this grant, we had written letters of recommendation from both the National Government Ministry of Mines and the National Government Office that controls informal mining, which is called SIMAP. And that was really powerful for us to have that kind of buy-in, because it definitely had a bit of a trickle-down effect where you would have mine owners, exactly right, that were probably not deeply invested in or not even hoping to change the status quo. But once you have some of the government actors, expressing support, that really helped move the needle forward. One thing that we saw, so 2 additional points. One was that, frankly, I don't think it would have been deeply interesting or compelling if we just told people, maybe particularly men, hey, we're going to talk for a year about gender equity. I'm going to be perfectly honest. I don't think the attendance would have been fantastic, especially among men if we'd done that. But what we did do was talk a lot about occupational health and safety, as we talked about the laws, the mining code, rehabbing mining sites, frankly, pretty technical details around within occupational health and safety, like tunnel reinforcement, how to prevent landslides and collapse of tunnels. Really was in some ways potentially life-saving information. And that really served as the entry point where people just couldn't get enough of that. They were so excited that we were talking about those issues, and that really served as kind of the portal to talking about other more challenging things. One note I will say, and Sabrina, I know you have your hand up as well, is that something that occurred was totally unexpected is we thought we were going to launch this project in March of 2020. And it turns out there was a global pandemic that really challenged us and stopped the project implementation for a few months. We had to pivot, we had to rethink what we were doing, move into open air venues, have personal protective equipment, and then eventually we were able to roll out the project after all. But one of the things that was really interesting to see was that already the facilitators were, beloved and trusted local actors. And then the training itself became something that people in the community were really excited about. And the Ministry of Mines and the Congolese government, as well as the district governments, then reached out to us and asked us to add COVID messaging and public health messaging within the training. So we actually went back to the artist, and she did all of these additional beautiful images around hand washing, what COVID was, what's happening to us. There's this global pandemic that no one understands, and we were able to integrate messaging within that intervention unexpectedly that happened between 2020 and 2021. And I think that also really helped us get a toehold within communities as well.
Thank you. That's very good. Sabrina?
Hello.
Hi,
Hi,
Sabrina.
Dr. Kelly. Thanks for sharing your work with us. I'm from Congo, and so it's really nice to hear all the work you're doing back home. I had two questions for you. I'm not sure if you maybe mentioned it earlier. I joined the meeting a bit late. I wanted to know in what languages those meetings were led in, and also whether you recruited teens within your participant samples, just because I know there are teens who work in the mining
Yes.
industry, and so I wanted to understand whether you also included them in your participant groups.
Yes. And Sabrina, just to make sure I understand fully, teens as in like teenagers or adolescents?
Yes,
Okay,
teenage
perfect.
adolescents.
Yeah, so great question about the language. We had facilitation materials, like the notes for the facilitators were in French and Swahili, but then they took those notes and like internalized them and then went ahead and did the trainings in whatever language was most helpful for the community where they were. So that could definitely be Kihavu, Mashi, etc. We were in the East, so we were North Kivu, South Kivu, and Maniema, so less Lingala and things like that, but very much, and this might feel like something that you know very much, but it's often a mix too. You like pick the best word for what you're trying to describe, and some like more technical words might be in French and Swahili, but then a lot of the like core discussion would happen in whatever language is most comfortable or used in that particular place. And then to the question about whether teens and adolescents were recruited, you know, this is a great question. I think as a researcher, I'm often sensitive to doing research with anyone who's 18 and under, because that entails so many additional ethical considerations. So in the intervention, we did work with those who were 18 and older because we were adding research components as well. And I don't know if this is maybe something that you are getting at as well. There's an enormous amount of sensitivity around child labor in the mines in Eastern DRC. So people have been aware that children should not be doing physically dangerous jobs in and around the mines. Having said that, the mines are one of the few kind of economic drivers in some of these areas. And so people really want to work in them. Women want to work, adolescents want to work in the mines because it is a source of opportunity. And so what we absolutely did do is try to engage often marginalized or underrepresented or overlooked groups. And that 100% includes youth. And I think youth in particular in DRC are facing so many challenges, and we often work with youth groups that have come together to kind of advocate for themselves and provide peer support. So we engaged youth, but not under the age of 18 for those ethical considerations. Yeah, it was a great question.
Thank you, Sabrina. Thank you, Jocelyn, for your answer. I wait for other people to raise their hands, but in the meantime, in fact, we have Sonia. So yeah, go ahead, Sonia.
Hi, hello. I absolutely love the presentation. I think I wanted to ask about the results on the level of violence being decreasing only in one of the two groups. I was just wondering if you could talk more about why, particularly the interconnected group, shows like a lower decrease in violence, but then the other one doesn't show that. And so I was wondering if you can talk more about that. And also I wondered, have you guys conducted perhaps like qualitative interviews to see women and how their interaction with men have changed? Yeah.
Okay, I did not plant this question, but Sonia, this is like, I'm so glad you asked, because this is kind of what we're sitting with now, right? In some sense, it feels like there's this secret ingredient that we suspected might have some kind of an influence, right? And this was based on just an intuition from these extraordinary partners, but also from myself. You know, I've worked in some of these mining areas for 20 years now, and we just felt like there was a sense of cohesion missing, and we thought that maybe the empathy and interconnectedness work could help address that. We also, like, what's more powerful than that sense of interconnectedness when you're thinking about links between people and also links between people and their environments. So we wanted to dig into that, and we were not expecting to see the kind of changes that we saw. Absolutely not. I mean, to see kind of a 50% like halving of violence was shocking and unexpected. And one thing I wanted to note is this happened during the early days of COVID, when we saw levels of violence against women skyrocket everywhere else. And in fact, in the other group, levels of violence did increase slightly because of those deep stressors on communities as a result of the pandemic. One of the things that we measured when we were first rolling out the intervention was how mineral prices had changed and how food security in the house had changed. And we saw that women, food insecurity had increased intensely. And actually, the co-author on that paper, Pham, is here, and it's so nice to have her in the group. But we saw food insecurity increase, and women were actually skipping meals because of that intense economic insecurity, which almost always leads to tension within the household and increased levels of violence. To your point, I mean, Sonia, yes, like the next step is to do the qualitative work, and that's what we're really advocating to do now. We are hoping so very much to be able to continue this work and really delve into what is it about empathy and what is it about interconnectedness that seems to have changed these dynamics. And I have to tell this one story because I think it's really charming and it always makes me laugh a little bit about this work. So as I said, we did all of this intensive like monitoring and evaluation before and after every session. And in the interconnectedness group, we would talk to men and women as they were leaving and have them fill out these, forms. And the closest we got to deep qualitative work was having them answer open-ended questions. And what we found from the men was they were like, we absolutely love this. It's the best training ever. We can't wait for the next time. The only thing you should get rid of is that interconnectedness, empathy stuff. It's so terrible. We hate it. It's so uncomfortable. We never want to do it because of course it's uncomfortable, right? That means it's working. If you have to put yourself in the shoes of someone who's being abused or marginalized or discriminated against, you have to really feel that and think about it in role play or active listening. It was almost this way to tell that it was working. People did not want to do it, and it felt so awkward for them to engage in this empathy work. But then what you saw at the end of the intervention was like something worked. All of that discomfort ended up having some kind of an influence. And what we really want to do is dig into like the mechanisms of that through more qualitative work. Absolutely.
Thank you. Phuong, did I see your hand momentarily? And would you like to come in? If not, Gioni.
Hi, thank you so much for your presentation. I was wondering, and you touched on this a little bit, but what are some next steps for the results in the project? You mentioned that this is USAID funded, so is this something that'll be scaled up within Congo or in the region?
Yeah, so I'm actually coming to you from Mexico City, where we're really lucky to work with some extraordinary women academics who were visiting scholars at Harvard last year, helped me think through some of the resourceful empowerment results and said, like, wait a minute, we're doing some mining in Querétaro here in Mexico. And like, let's think about maybe adapting this curriculum for our context. So that's really exciting to see. I'm going to be, perfectly honest. And I think this is an aspect of doing public health work is a lot of times we are advocating for funds and trying to work with multilateral or government or foundation donors to keep the work going. And one of the wonderful things about implementing during COVID was that we could incorporate COVID messaging into what we were doing. And one of the challenges is that, frankly, for a lot of understandable reasons, I think global attention really moved towards pandemics. Of course it did, right? But we have been putting together so many project proposals and sending them out. And we really thought people would just be like, couldn't wait to take this forward, couldn't wait to expand it, couldn't wait to kind of fund the qualitative research that dug into the dynamics around empathy and violence reduction. And I think we are getting some traction, but it's been so much slower than we expected. And so it really has been a little bit of a slog to keep this work moving. Having said that, there is another RISE challenge that went out this past summer, and we absolutely applied as this consortium to expand, build up, and do more research into the findings from the 2020 work. So we're kind of waiting to hear around that. And then we've also, continue to advocate with some other donors. So please stay tuned. We're really hoping we get to move this forward.
And actually, Jocelyn, I have a supplementary to that question from Gioni. How are the federal government, ministries, and other local leaders interested or not in somehow continuing with this and maybe even scaling it up?
Yeah, that's a great question. And we were pleased at the uptake. And again, I think COVID helped. Everyone was looking around to say, like, who's going to lead on this? Who has answers? And we were out there in communities with communication materials ready to do some of that communication. And I think that did buy us goodwill from both the national and kind of district level governments. It hasn't expressed itself as like concrete funding, and sometimes it is hard. Certainly district level governments, I don't think, have huge amounts of funding. We did want to create a curriculum that was low cost, right? Those materials exist. We've laminated them so they can go out in rainy season and people can talk about and raise awareness around all of this information, but you still are left with paying for the motorcycle taxi, paying for the cell phone credit to make sure you can go to the community that you're going to. And that's real. You can't do this for free. That's not fair to expect these community-based organizations to work for free. And so we are hoping that either USAID and the Congolese government or someone will step in and help this work continue. It's not that expensive, so we're keeping our fingers crossed.
Thank you. Elisa?
Thank you, Jocelyn, for the great presentation. Very interesting work. Following up on some of the comments that has been made, and also your latest point on cost. One of your first slides, trying to think about through the project, you mentioned that you were thinking about training that would be cost effective. So I was wondering whether you could speak more about it and whether you were able to have a sense of the cost and cost per benefit, that whether you measure that in kind of reduction of the violence, what work better or not, thinking about this scalability problem, and who is willing to take this up in a way or spend money for this, given the great kind of benefits that you find in terms of reduction of the violence.
Yeah, exactly. And Eliza, I think there's two kind of research elements that I think would be really interesting to do. One is an RCT, right? We're just presenting pre-post findings. And so of course I want to, that, we're not, the communities were randomly assigned, but we want to do, maybe a more scientific measurement as well as that qualitative work to figure out what's working and why, like which levers can we keep pulling to see good results? Why is it that empathy works, and figuring out the pathways you can, dig into that, right? But then very much to your point, there's a kind of research you could do, which is around cost benefit analysis, and violence reduction is hard. We don't always know how to do that particularly well. If we solve that problem, it wouldn't be one of the world's greatest problems, to address gender equity. And so I think that there is really a case to be made around how low cost this intervention is for pretty notable results that address both climate change and gender-based violence. At the end of the day, it is inexpensive, right? Like, yes, you have to pay the motorcycle taxis. Yes, you have to pay the cell phone minutes, and honestly, we want to support these extraordinary community-based organizations who frankly shouldn't have to work on a shoestring but we still have to say like, but it can, if it has to, we can do this for very little money, because what we had envisioned is that training of the trainers model, where it's a bit of a, you know, pyramid shaped thing. You train a few trainers, each of them train others, et cetera, but you still want to make sure that those people are being supported, that they're not doing this work out of pocket, et cetera. So we don't have like, I will say this was not a particularly expensive project for all that we did achieve. It did not cost very much in the grand scheme of things. And now that the intervention materials are created, I think it would be even more cost effective as well. So that is the argument we're trying to make to donors. Yeah.
Thank you.
Thank you, Jocelyn. Any other questions or clarifications? We just have the last couple of minutes. So if you want to still be part of the discussion, raise your hand now. And if not, then it's my very pleasant duty to thank Jocelyn for coming to us and presenting very, very interesting material, and for all the people who took part in the discussion, and for all others who attended. Again, thank you.
Thank you all. Have a great day.